Today we're focusing on fibromyalgia. There's a lot of new treatments out there, and actually it affects about 5.8 million people, so it's pretty prevalent. Thank you for coming in.
Thanks for having me.
Tell us about fibromyalgia a little bit, and what are the symptoms of it?
Well, fibromyalgia is a widespread pain condition that often results in tenderness in the skin and just overall discomfort. They also have complaints of chronic fatigue and feeling tired, and sometimes will even report kind of a brain fog, like they're just not able to concentrate well and be able to maintain focus. Sometimes other symptoms that are less specific, they may have headache, they may have irritable bowel syndrome, they may have numbness and tingling in their extremities. So there's a few things that impact the majority of people, but there are still some very individual specific symptoms that affect people.
And it can be debilitating for those people who do have it. And oftentimes, like you say, it's a troubleshooting method to try to figure out what is causing it. I know you guys have trials going on over there right now at CNS for this specific kind of an ailment.
We do, and some of the issues that patients have is there's a, to be diagnosed with fibromyalgia comes with some stereotypes at times about the patient that it affects. And finding a pain management regimen that is effective without the side effects is also problematic. So there are treatments specific for fibromyalgia available to patients. Some of those include Cymbalta, Savella, Lyrica, sometimes other pain management tools such as tramadol, but sometimes those medications cause other unwanted side effects that make it hard to find a good benefit to continue taking it versus the risk of the side effects. So some of the things that we look at, we're looking at evaluating the effectiveness of a new medication that may have those same pain management benefits without the side effects that are currently out there.
And one of the ones you named off there first is an SSRI, Cymbalta, and I know that Lyrica can be given to people for different reasons as well. And I think over time what they found is that some medications that you would give to somebody for a different diagnosis, the side effects of the medicine can actually help people with fibromyalgia. So this is interesting in the fact that you guys are actually trying a new medication specifically pinpointed at fibromyalgia.
Well, it does. Well, it works along the neuropathic pathways, as many of those medications do, but the thing that you have to try to do in treating it is finding a good response within a medication and limiting the side effects.
Right.
So this, the medication that we're looking at has a targeted response with fewer side effects, and so that we hope to have a better outcome for patients.
You know, there's one picture that you sent in where their lady is sitting there like this. We have it, and it's very, as one doctor told me, it's very indicative of someone who is in pain. It is one of those kind of motions that when you see someone, you know there's a problem. That picture right there is the one I was referring to. And that just everybody around you in the room is like, what's wrong? And it really can be that debilitating.
It can, and you know, they showed pictures of women, and while predominantly 80 to 90% of the patients suffering from fibromyalgia are women, it also does impact men as well. And so it's very important. One of the things that we offer, you know, if you're uncertain if you have this condition or you're concerned about your current treatment regimen, we are able to have you come into our clinic for an assessment that's at no cost to you, just to kind of review your symptoms, your current treatment regimen, and to determine if possibly a clinical trial is right for you.
And the nice thing about the clinical trial is oftentimes, well, you don't need to have health insurance at all to participate. And so what this does is give you an opportunity to be able to get some much needed medicine if you're suffering from something like fibromyalgia. If you cannot afford to see a regular physician or have those routine office visits, this is a great alternative for many people.
And some of the patients that are complaining when they come in, some of the issues they have is the cost associated with the medication. Even if they have insurance, some of the co-pays for the new medication out on the market is very difficult for them to afford. And so this is a great option for those folks who are still struggling financially to have some of their health care needs met.
I mean, they just simply cannot afford the Lyricas and the Cymbaltas.
The co-pays.
Because oftentimes that happens because there's not a generic medication out for something. So if it's a name brand, I know if a pharmaceutical company has the name of it, it can oftentimes you pay top shelf price, and there's just no other alternative around that, right?
Yep. That's correct.
Now, you guys also offer compensation sometimes for people that would qualify for a trial. Can you explain that?
Within the context of a clinical trial, the participation is voluntary, and so for those patients that enroll in our clinical trial, they receive a stipend for time and travel for each visit that they complete once they're enrolled in the study, because we do realize it is a time commitment, and you do have to attend visits a little more frequently than you would normally in your outpatient provider's office.
Okay, so I guess, and what would you tell people kind of to do at this point if they have any of these symptoms of fibromyalgia and want to take part? How should they reach out to you?
We are available to schedule appointments if you dial the number there on the screen, and then also you can visit our website at www.cnshealthcare.com, and you're able to schedule appointments there online as well. And the other benefit we have is we can get you in same day if need be, or within that same week if it works with your schedule.
Okay, so that's good. So if someone does want to take part, oftentimes we know doctors are busy and you have to wait a couple days to get in, but what you're saying is the turnaround time is pretty quick.
Yes, ma'am.
All right.
Yeah.
Susan Angel from
Thanks.
CNS Healthcare, thank you so much.
Thank you
for coming in. Great to have you.